I'm Wilcher at Star Therapeutic Massage. Today we're going to do some self-treatment techniques for the low back. Hi, the first technique we're going to show today for low back pain is using a high bounce ball. I recommend a high bounce ball because it's inflatable, and I use this a lot of times when I'm driving to and from work, but for most recommendations, if you're having pain somewhere at a grocery store or something like that and you need to get away, you can take this and put it, the seats and most cars are curved in, so getting in, you can take the ball and slide it in there, and it puts direct compression in on the part of the muscle that hurts. So what this does is it exhausts that muscle over a period of time. So you leave it there until you feel the pain relief. Usually it takes 1 to 2 minutes. What it does is it exhausts the muscle, then the muscle kind of like flattens out, and then as you release the pressure, fresh new clean blood goes in there to help heal that situation. This is great because a lot of times when I'm driving, I can drive with this in. The reason I recommend a high bounce ball is it has air in it, and it could be smashed if you happen to be hit. You don't want to have a softball or a baseball back there because it's not collapsible. Hi, this is technique number 2, using a high bounce ball, and this is called a pinky ball. It's a solid rubber ball. You can use it for low back pain, also sciatica. Sciatica can run down the leg, or sometimes the pain in the upper glutes can run up into the low back. The way that you use the high bounce ball is you get down, you put this under your low back, and you lay back on it. Now you can roll onto it, and where you feel the discomfort, sometimes 1 to 2 minutes. Once the discomfort eases, you can rock back and forth a little bit on it for 15 to 20 seconds or more. Then you slowly come out of it and move it down a little bit and repeat. Now, oftentimes sometimes the low back pain can also be due to the fascia over the sacrum, your tailbone, it gets dehydrated and it adheres to the bone. So you can take the ball and put it right on your sacrum and hold it there for 1 to 2 minutes, and then you can rock back and forth on it very easily like that. And that helps loosen that connective tissue so that it relieves the pain. Now, if you need a more precise, detailed work, you put this ball to the side and you get your pinky or a hard rubber ball. Some people will use a tennis ball, but a tennis ball is very collapsible. If you're over, say, 170 pounds, you may need something a little bit more solid. So you can take this ball and you place it along the edge of your tailbone where you're feeling the pain at, and you can take your leg, your right leg, since it's on the right side, you can take your leg down and up, or you can bring your leg out. Sometimes that's where you feel the most discomfort, and you just kind of just hold it there until it eases up. Once it eases up, and bring it up here, you take the ball, move it down a little bit more on the edge of your tailbone, bring your leg up and down. As you get down farther, you get right down to the sciatic nerve. The sciatic nerve runs under a muscle in your lower glutes, and the nerve either runs under the piriformis or through the piriformis. So you want to take the ball, instead of putting it on the edge on either end of it, because one end attaches to the hip bone, your femur, and the other one attaches to your tailbone. So you want to put the ball in the middle, and then you slowly bring your foot up till you feel it engaging or you feel like a discomfort. You just kind of hold it there, and what that does is it helps the piriformis to relax and then release. And then once that happens, then you take it out. Okay, this is technique number 3, that you can use the high bounce ball for working on your low back, hip pain. A lot of times you're in an office setting and you're at work, well, you can take this just about anywhere. Most people got a purse like, you know, the size of a saddlebag. So you just take it and you can put it in the middle of your back, move it over to the side, and you sit there and lean on it like this, rock back and forth, and get some relief from that pain. Also, most times you have an office chair. You can also take this and slide it back here behind your back. And you know, you can continue doing whatever you're doing, typing or computer work or whatever. And while you're doing it, it's exhausting that muscle and causing it to relax. Now, another technique you can do in the workplace is you can have pinky balls, hard rubber ball, and ideally I put it inside of a sock. Now, if you want to use the same sock for your high bounce ball or your pinky ball, you get a size 13. It's the biggest men's sock that I could find. So what you do with this ball is you slide it over your shoulder, you lean back against the wall, try not to fall through the wall, and you bring your feet out a little bit, and you can get it right along the edge of the scapula, and that right at the top of the scapula, you know what I'm talking about, where it's always hurting, it feels like somebody stabbed you with a knife. Yeah, you can get in there and ease it, and you can flip the sock over the shoulder where nobody can see it. They just think you're leaning up against the wall like a wooden Indian or something. But this can really give you some relief. You slightly move around a little bit. Usually within 60 seconds you get a lot of relief. Now, the reason for the sock is it keeps you from dropping your ball and just running all over the room. Now, you can also use this technique in an office chair. The sock allows you to get it back there. You can ease it down wherever you want it. Sometimes it's lower, sometimes it's higher. And once you get it in the right spot, go back to work. And once it's relieved, you lean out, get your ball, move it over to the other side, do the same thing. It's very simple, and it's also a great technique to do at work, because a lot of times you can't leave because you're in pain, but this is something that'll relieve it until you can get to a therapist. Thank you for taking the time to watch these videos. I've used them hundreds of times on myself, and I've taught hundreds of clients how to use them, and I've got lots of good comments back from it. If you get an opportunity, if you could put a little results down on the comments section on how it worked for you, or if you have any questions on how it can be improved or made easier or whatever, just let me know. Like I said, I've done this hundreds of times, and it's worked for me, it's worked for all of my clients, and I think it'll help you feel better.